SHIP has been involved in Medelia through the hospital since SHIP started back in 2009. Candy Fensky, who is the CEO of the hospital, has been involved in our community leadership team, and so that was really kind of our step into the community. And since then, we've been able to have a partnership with the school, with Tony Downs Foods, doing worksite wellness, and the hospital, as well as the Medelia Community-Based Collaborative.
SHIP has been very good to work with. It's easy to work with. We've had members from the state level come down and visit with us and talk about things that we may look at, or just they have been interested in what we're doing, and so it feels good to have that collaboration.
The best thing about working on the Medelia-based collaborative project is you can see actual growth, actual movement, and you're really making a difference in the community. We're being able to fill the gap. We have faculty and students who have a lot of energy, and when they come into the community, some of the community members, you don't really realize what you have here and the potential that you have in the community. When outside members come in, they can really help ignite some energy behind the project.
So the collaborative, Medelia Community-Based Collaborative, is made up of a whole conglomeration of people. We have professors, teachers from Minnesota State University, Mankato. We have community members, the principal of the elementary school. We have an elementary student from the county. We also have from the Ministerial Association, we have one of the members from that, hospital employees. There's a large portion of the community that is obese, and obesity can lead to diabetes and heart disease, and so we figured out that we needed to tackle that problem. And we decided the easiest way to do that was to start with the kids. Kids are very impressionable, and so we formed the collaborative to reduce sugary beverage intake, and we just want to offer more healthy beverage choices and get the kids to know what are more healthy beverages.
That idea was really taken from the needs assessment, so looking at cancer, heart disease, and diabetes as top concerns in the community. What are some strategies that could potentially impact those conditions? One of the ideas that came forward was to look at a campaign to reduce consumption of sugar-sweetened beverages. And that can involve soda, it can involve chocolate milks, really basically anything with added sugar.
Part of the MCBC collaborative, they suggested doing a poster contest with our elementary students, and I contacted our teacher, Mrs. W, and asked her about doing that at the beginning of the year, and she was excited, and we went with it.
And what the kids have done is they have drawn a poster that has to do with how you think what you're drinking. And we also talked about some of the things that have to do with what are you putting in your body? Is it healthy? Is it not healthy?
I think they've had a blast with the poster contest because it allows them to be creative, the freedom to pick kind of what they want to put on the poster, and looking through the posters, there's lots of different things from connecting it with sports to connecting it with maybe a hobby that they have, and so they appreciate having that freedom to pick and choose what to put on there. So they've had a lot of fun with that.
We made this in art. I was thinking about water, so I put a pool because it made me thinking about water, and then Mountain Dew, but I X'd it out.
My poster is here because I like Rethink Your Drink, and if you drink pop, then it's not good for you, so you should really drink water like I have from a faucet, or put it in the fridge and make it cold.
People started drinking more water after we made them.
I really like water because it's really healthy for you and it has no sugar in it.
It's really good because it's really natural, and you can put fruits or vegetables in it so it can have a little bit more taste.
I drink milk before I go to my football games.
I've never drank pop, but I've just had a few sips from my mom's cup.
I don't really think I drink that much pop.
Rethink Your Drink probably has reduced it because now they're really thinking of what they're putting in their bodies. They're really deciding, you know what, this is not such a great deal.
I'm a big believer in not only teaching them reading and math, but also teaching them how to make good decisions. And this fits right into that in helping them learn to look at things, analyze, and make a good informed decision, which, you know, they'll take that skill with them the rest of their lives.
Passing it on to their parents, you know, in the grocery store, you know, asking, can you buy some water, buy some bottled water instead of the pop. We don't need the pop. You know, trying to get the kids to change the habits of the whole family, parents and included.
Active Living, we've been working with the Medelia Active Living Coalition, which was actually born out of the SHIP grant, and they have been successful at really engaging the school with Safe Routes to School and combining the Safe Routes to School work with the community work.
Active Living is where we try to get the people, the children, all the families and everything more active so that they aren't coming home sitting on the couch. Trying to establish walking, biking trails, and we had walk to school, bike to school days with the rest of the United States. We participated, had really good participation with that.
The bike path was an idea of the Active Living Coalition that children and adults would have a safe walking and biking path in Medelia, and noted that the old Highway 60 was not marked and had parking alongside, which made it dangerous. So we went to the Medelia City Council and petitioned, along with Roger Reeser, the county engineer, that we could have markings and signage for a bike path.
Looking at ways that they can create some connectivity between the community assets. So one of the things that they just had accomplished was extra lighting and a new trail that was put up between the hospital, which connects the hospital, the high school, Tony Downs Foods, and the recreational Parks and Rec in Medelia. So we were able to, through the SHIP grant, write an innovative application to the Department of Health, and we're funded to really look at how do we increase access to healthy beverages by working with different organizations such as Tony Downs, looking at their vending machines. Do they have water available? Is there education to the employees about the types of beverages and the amounts of sugar that they have in the beverages? Since we worked with Tony Downs since the beginning of SHIP for the most part, we've been able to work on developing a comprehensive worksite wellness policy that incorporates things like tobacco-free grounds, also looking at improving physical activity opportunities.
Well, basically we're getting together every month, some workers and me and some coordinators, and we talk about the needs, what they need, what they want, and we've been doing this health awareness program every month. For example, we did blood pressures last month, and we're gonna be checking cholesterol and glucose.
Many of the people that are working here don't understand how to go to a doctor, who you should talk to about a specialist, how to take care of themselves. Some don't understand what cholesterol and triglycerides are. Some we've discovered diabetics, they didn't know that they were diabetic, they had no idea what the symptoms were. So education is a big factor. We tell them what to look for, and to prevent it, you know, what you should eat, what you shouldn't eat, how to exercise, things like that.
Well, basically right now we just done blood pressure, and we're gonna start educating about glucose and cholesterol, why is it important to check it, and what to do if it's high or low. And we also talk to them, and they talked among themselves, which is really good to see what they needed, what they wanted. So, and we also did the garden. This garden project, we talked what they wanted to grow. We're trying to make them grow their own vegetables. And we had 10 different seeds. So we brought the pots, the soil, and they got to choose. And it was really fun, and talking about how they grew, and everything was really, really good, and they shared their vegetables. So that was really interesting.
I stay in the program, Wellness, and we like to invite the people to explain everything about the barrel we planted. And we have a garden outside. We don't want to make a big garden, but we like to explain to the people we growing like a 2 seed or 3 seed in the same barrel, and it was growing good. And we have tomatoes and also cucumbers, and it's about 60 people. They bought the barrel. It was everything inside, and also the planted tomatoes, the jalapenos, and different kind of stuff.
They seem to like it. In this plant we run a health and wellness committee, and once a month they get together and they discuss what they'd like to learn. So obviously we did a garden because they wanted to learn how to grow vegetables, and we wanted to teach them what's the healthy vegetable, which vegetable should you be eating.
The healthy was good. That's because when somebody has had a problem, we let us know to the supervisor, and they take to the office and help. Whatever problem we have, they help you and take like therapies or something to help us.
You know, we're part of the Medelia community, and we need to give back. And giving back to our employees, who obviously live in this community also, is just one way of doing it.
We're talking about the importance of drinking water or not soda pop. I'm actually doing right now is a lot of drinks that Mexicans have. They're not all from here. So what I'm getting is how much sugar they have, and also they have it in metric system. So I'm changing it so they understand exactly how much it is here. So they can actually see it and visualize, well, here it is. Because sometimes they think tea. Well, it's not the natural bag. They buy the bottle, and that has a lot of sugar. So we're trying to show them how much actual sugar is in it.
I have lived in Medelia my whole life. I was born and raised here, and it's good to see the changes that are happening. It's slow, but they're happening. The change in the kids' activity, kids walking to school, riding their bikes to school, reaching for water instead of the sugary beverages. It's happening, and it's good.